I like to know things.
So now I'm going to talk about cures for mental illnesses. The references that I'm going to quote have been put together in a PDF. You can find a link to that file in the information section on the video. Feel free to download it and look at the references yourself. This video not only is going to talk about cures for mental illnesses, but also give you an idea of what you can expect from psychiatric treatment as far as an outcome is concerned. These references are not my opinion. I'm actually using some of the highest authorities in the mental health field tonight. So these are the opinions of the top dogs of mental health. Okay, the first reference here is a medication guide from the National Institute of Mental Health of the U.S. government. It says relief from symptoms. Just as aspirin can reduce a fever without curing the infection that causes it, psychotherapeutic medications act by controlling symptoms. Psychotherapeutic medications do not cure mental illness, but in many cases they can help a person function despite some continuing mental pain and difficulty coping with problems. How long somebody must take a psychotherapeutic medication depends on the individual and the disorder. Many depressed and anxious people may need medication for a single period, perhaps for several months. People with conditions such as schizophrenia or bipolar, also known as manic depressive illness, or those whose depression or anxiety is chronic or recurrent, may have to take medication indefinitely. This reference is from the National Gaines Center for People with Co-Occurring Disorders in the Juvenile System. This is part of the Substance Abuse and Mental Health Services Administration of the U.S. government. It says treatment strategies. It is important to note the distinction between the terms management and cure. In both severe mental illness and substance abuse, treatment provides work towards effective management of disorders rather than the unrealistic expectation of a cure. Management strategies are intended to keep youth with co-occurring disorders in contact with treatment systems over a long period of time. Alright, so check that out. It says that treatments work towards effective management, not towards the unrealistic expectation of a cure. So the idea that you can be cured of a mental illness is considered by the Substance Abuse and Mental Health Administration of the U.S. government to be an unrealistic goal. This is a statement to the Federal Drug Administration made by the American Psychiatric Association. That said, we must emphasize that currently available medications do not cure mental disorders. Of necessity, psychiatrists and other physicians often must prescribe over long periods of time medications approved for acute indications. You might notice in those last two videos they mentioned medication over a long period of time. That's all to the profit of the pharmaceutical industry. The next reference comes from Mind, which is a leading mental health organization in England and Wales. It says, however, these drugs don't cure mental distress. Medication can relieve the symptoms of mental distress, but the underlying problems often remain. Drugs can also have side effects that may make people feel worse rather than better. They need to be used with caution. Taking minor tranquilizers can be seriously addictive, while antipsychotics in high doses can cause permanent damage to the central nervous system. So medications can relieve symptoms, but the underlying problem often remains. It also says drugs often have side effects that can make a person feel worse, and some drugs can actually cause permanent neurological damage.
Photographer back in my old days. Wait, stop.
Okay, that's great. I'll introduce myself again.
All right. Now do it again. Start over again.
Great. It started a year ago with my tongue jerking back all the time, but it progressed pretty quickly within about 3 or 4 months.
Okay.
It's gotten worse.
Okay.
It's gotten worse since I've seen Dr. Trevor.
Oh, really?
I now have a stutter, and I now have this
kind of a more complex set of movements around your mouth, it looks like.
Yeah, well, the inside of my mouth right here hurts from my teeth. You know,
Yeah, pretty frustrating problem.
and the stutter's pretty bad.
Okay.
The next reference is from the Substance Abuse and Mental Health Services Administration. This is from Evidence-Based Practices, Shaping Mental Health Services Towards Recovery. It says, taking medication is not a cure for mental illness, and there is no guarantee that you will not have an acute episode again. So there you go. Mental health medications aren't a cure, and it's no guarantee that you won't have an episode again. Next reference is also from the Substance Abuse and Mental Health Services Administration, Evidence-Based Practices, Shaping Mental Health Services Towards Recovery. It is your decision whether to take medication. Medications are not perfect, they don't cure mental illness, and they have side effects. Medications also help some people more than others. Okay, so medications have side effects, and they help some people more than others, and they're not a cure. Okay, the next one is from the American Psychiatric Association. This is Practice Guidelines for the Treatment of Patients with Bipolar Disorder. It says, although medications are widely used to treat patients with borderline personality disorder, the Food and Drug Administration has not approved any medication specifically for the treatment of this disorder. It also says, pharmacotherapy has demonstrated significant efficacy in many studies in diminishing symptom severity and optimizing function. However, cure is not a realistic goal. Medications do not cure character. So, cure is actually an unrealistic goal. This is from the President's New Freedom Commission on Mental Health. Since many psychotropic medications are treatments and not cures, some individuals with chronic illness, including children, must use them on a long-term basis. There you go, the long-term basis thing again. Another quote from the President's New Freedom Commission on Mental Health. However, since these medications are treatments and not cures, some individuals with chronic illness, including children, are expected to use these medications over an extended period of time. Knowledge of the clinical and economic effects of these medications is limited because systematically evaluating the maintenance use of medications is not required for FDA approval. Consequently, long-term effects have not been well studied for many psychotropic medications. So to give you an idea there, it says that it doesn't require a long-term study for medications to be approved by the FDA. In most cases, they only require about a 6 to 8 week trial, and the only thing that's required to get the drug approved is that it wasn't radically dangerous in some way, and that it showed a little bit more of an effectiveness over a placebo. Drug can actually get approved. It doesn't necessarily mean that 90% of the people got better, or 70% or 50%. It just has to beat the placebo. So if the placebo has a 30% response rate, the drug can still be approved if the drug shows a 31% response rate. Drugs get approved because of short-term studies, and then they end up having side effects on a long-term basis. An example is Vioxx. It was recently taken off the market because it killed people. That didn't show up in a 6 to 8 week trial. It took longer before that side effect started to show. So there you go. Now those are the leading authorities of mental health in the United States, and they all say that these medications are not cures. They have side effects. There's no guarantee that you won't experience mental illness again. There's no guarantee that it will reduce all of your symptoms, and that's what they're trying to do, is simply reduce symptoms.